Hello everyone, I am Dr. Sibasish Dey. I take care of the clinical affairs team in ResMed and has been working with patient-centric solutions for quite some time. And those solutions are mainly directed towards treating sleep disorders in different populations. So today we are going to discuss a very important topic of snoring and its relationship with sleep breathing disorder, which is also known as obstructive sleep apnea. Snoring is one of the very commonest signs which we find in our clinics. We find it in our homes very often. We have seen our family members doing it, kind of snoring at night. And when we conducted the recent survey, the ResMed Sleep Survey 2023, we even found that close to 58% of the patients or the respondents of this survey regarded snoring as a good sign of sleep, and which is something which we were quite aware of, that people would think snoring to be very normal. But what I would say is that snoring is not a good sign of sleep. It is a sign which basically leads to obstructive sleep apnea, and there are different implications of obstructive sleep apnea in both short term and long term, right? So let me also enumerate what are the different long-term associations of obstructive sleep apnea with different diseases. So when I say different diseases, this particularly means or relates to cardiometabolic disease. Like we often see patients with type 2 diabetes mellitus, and up to 50% of all this patient population have some sort of sleep apnea. You would also be it's a very interesting fact to understand that even stroke patients, close to 82% of the stroke patients have association with obstructive sleep apnea. So I think the list goes on, and there has also been associations with resistant hypertension, with cardiac diseases like heart failure and arrhythmia, to name a few. So obstructive sleep apnea has connotations, or rather associations, with different cardiometabolic diseases. So now when we talk about OSA or obstructive sleep apnea, the symptoms are very innocuous. There are common symptoms which typically the bed partner sees, which is like snoring, or maybe gasping for breath at night, or maybe a cessation of breathing at night, these are the symptoms which are typically noticed by the bed partner. But what gets noticed during daytime is the excessive daytime sleepiness which these individuals who snore and who have OSA are seeing. For example, someone is falling sleepy during a meeting, or simply feeling sleepy while having a gossip or having a gupshup with the family members. And in dire circumstances, we have also seen people sleeping on their steering wheels and meeting with an accidents. So there are different daytime symptoms, and excessive daytime sleepiness is one of that, right? In addition to that, what we have also seen is that these people also have work-life issues. For example, the work productivity goes down. There is an issue maintaining the work-life balance in these people who have obstructive sleep apnea, right? So but the greater issue is that although there are many people or individuals who are suffering from OSA, close to 29 million patients in India, almost 85% of this population won't ever get diagnosed, because there is a barrier for these patients to actually reach out for diagnosis. For example, during our survey, we found that almost 97% of Indian respondents said that they had a barrier to get diagnosis for sleep apnea or any other sleep disorder. So they simply did not know where to go and whom to meet and where to get the solution. So I think this is one of the important issues, right? But I think at least from ResMed, there is a diagnostic tool called One Sleep Test, which is a disposable multi-night diagnostic tool which can help diagnose sleep apnea easily at the comfort of your home. So that is something which is there, right? And in addition to this, what I would say is that treatment of sleep apnea is very much possible. There are different lifestyle management or lifestyle modifications like losing weight, quitting of smoking and alcohol. These are undertaken during this treatment. And of course, there are gold standard therapy like incorporating a PAP device or a CPAP device, which is commonly known for treatment. So, few last words is that please, if you have a sleep disorder, don't keep it up to yourself. Visit your physician, speak with your friends and family, seek help, and get your life in order. So, signing off. Thank you so much.